The kidneys, those unassuming bean-shaped organs, are the silent workhorses, filtering waste and excess fluid from the blood, maintaining the delicate balance of electrolytes, and producing hormones essential for blood pressure regulation and red blood cell production. Yet, these vital organs are often overlooked, their importance underestimated until their function is compromised. Kidney diseases affect millions worldwide, often progressing silently and asymptomatically until significant damage has occurred. Imagine the kidneys as sophisticated filtration systems, diligently working to cleanse the blood and maintain the body's internal environment. At the heart of this intricate system lie millions of tiny filtering units called nephrons. Each nephron contains a glomerulus, a cluster of microscopic blood vessels that acts as a sieve, allowing waste products and excess fluid to pass through while retaining essential proteins and cells within the bloodstream. The glomerular filtration barrier, a complex and delicate structure, is key to this selective filtration process. Disruptions to this delicate balance, whether due to inflammation, immune system dysfunction, or genetic mutations, can lead to kidney diseases, including nephrotic syndrome. Nephrotic syndrome arises from damage to the glomeruli, those microscopic filters within the kidneys responsible for cleansing the blood. This damage disrupts the delicate filtration barrier, leading to the leakage of proteins, primarily albumin, from the bloodstream into the urine. As albumin leaks into the urine, the blood loses its ability to retain fluid within the blood vessels, resulting in swelling, or edema, a hallmark symptom of nephrotic syndrome. The loss of albumin also disrupts the delicate balance of lipids in the blood, leading to elevated levels of cholesterol and triglycerides, increasing the risk of cardiovascular disease. Diagnosing nephrotic syndrome typically involves a combination of clinical evaluation, urine tests to detect proteinuria, excess protein in the urine, and blood tests to assess kidney function and albumin levels. However, pinpointing the underlying cause often requires more invasive procedures such as a kidney biopsy, which involves obtaining a small sample of kidney tissue for microscopic examination. In the realm of medicine, biomarkers serve as invaluable clues, providing objective measures of biological processes, disease states, or responses to therapeutic interventions. By detecting specific molecules or patterns associated with a particular condition, biomarkers enable earlier and more accurate diagnoses, facilitating timely interventions and potentially improving outcomes. In the context of kidney diseases, biomarkers play a crucial role in assessing kidney function, identifying specific disease subtypes, and predicting disease progression. Traditional biomarkers, such as serum creatinine and blood urea nitrogen, provide a general assessment of kidney function but lack sensitivity and specificity in detecting early kidney damage or distinguishing between different kidney diseases. The quest for novel, more sensitive, and specific biomarkers for kidney diseases has been a major focus of research, driven by the need for earlier diagnosis, more precise disease classification, and personalized treatment strategies. The discovery of anti-nephrin autoantibodies as a biomarker for nephrotic syndrome marks a significant leap forward in this quest, offering new hope for patients battling this challenging condition. The search for better biomarkers in nephrotic syndrome has been driven by the limitations of existing diagnostic tools. While urine tests for proteinuria and blood tests for kidney function provide valuable information, they lack the specificity to pinpoint the underlying cause or predict disease progression accurately. The ideal biomarker for nephrotic syndrome would be easily accessible, measurable in a minimally invasive manner, and highly specific to the disease process. Scientists have been exploring various avenues in search of such a biomarker, investigating genetic markers, proteins, and antibodies associated with nephrotic syndrome. One promising avenue has been the study of autoantibodies, immune system proteins that mistakenly target the body's tissues. Among these, anti-nephrin autoantibodies have emerged as a potential game changer, exhibiting high specificity for a particular type of nephrotic syndrome and correlating with disease activity. The discovery of anti-nephrin autoantibodies as a biomarker for nephrotic syndrome marks a significant milestone in the field of kidney disease research. Nephrin, a protein critical for the integrity of the glomerular filtration barrier, plays a vital role in preventing protein leakage into the urine. Anti-nephrin autoantibodies, as their name suggests, specifically target nephrin, disrupting its function and compromising the integrity of the filtration barrier. These autoantibodies are found in a subset of patients with nephrotic syndrome, particularly those with minimal change disease, the most common cause of nephrotic syndrome in children. This discovery has significant implications for both diagnosis and treatment, potentially paving the way for more targeted and effective therapies. Identifying anti-nephrin autoantibodies in patients with nephrotic syndrome provides valuable information, aiding in accurate diagnosis, predicting disease course, and guiding treatment decisions. Detecting anti-nephrin autoantibodies requires sophisticated laboratory techniques that can identify and quantify these specific antibodies in the patient's blood. A groundbreaking hybrid technique combining the strengths of two powerful methods has emerged as a highly sensitive and specific approach for detecting these elusive biomarkers. This innovative technique leverages the power of both cell-based assays and enzyme-linked immunosorbent assays, ELISAs, to achieve superior sensitivity and specificity. Cell-based assays involve using living cells that express nephrin on their surface. The patient's serum, containing a mixture of antibodies, is added to these cells. If anti-nephrin autoantibodies are present, they will bind to the nephrin on the cell surface. The ELISA component of the hybrid technique adds another layer of specificity and quantification. The discovery of anti-nephrin autoantibodies and the development of a highly sensitive and specific technique for their detection have profound implications for the diagnosis and treatment of nephrotic syndrome, particularly minimal change disease. This breakthrough offers a less invasive alternative to kidney biopsies, potentially sparing patients from the risks and discomfort associated with this procedure. The ability to detect anti-nephrin autoantibodies in the blood provides a less invasive and potentially more accurate way to diagnose minimal change disease. Earlier and more accurate diagnosis allows for prompt initiation of appropriate treatment, potentially improving long-term outcomes. Studies have shown that patients with minimal change disease who test positive for these autoantibodies are more likely to respond to immunosuppressive therapy, the mainstay of treatment for this condition. Conversely, patients who test negative for anti-nephrin autoantibodies may not benefit from these medications and may require alternative treatment strategies. The discovery of anti-nephrin autoantibodies and their role in nephrotic syndrome has ignited a beacon of hope for patients and clinicians alike. This breakthrough has the potential to transform the diagnostic and therapeutic landscape for this challenging condition, paving the way for more personalized and effective treatment approaches. As our understanding of the role of anti-nephrin autoantibodies in nephrotic syndrome deepens, we can envision a future where a simple blood test can accurately diagnose minimal change disease, sparing patients from the need for invasive biopsies. This non-invasive diagnostic tool will enable earlier detection and treatment, potentially preventing or delaying the progression of kidney damage. By tailoring treatment plans to individual patients, we can maximize therapeutic efficacy while minimizing potential side effects. The journey leading to the discovery of anti-nephrin autoantibodies and their role in nephrotic syndrome is a testament to the power of scientific inquiry, the relentless pursuit of knowledge, and the unwavering commitment to improving human health. It is a story of collaboration, innovation, and the tireless efforts of researchers, clinicians, and patients working together to unravel the complexities of disease. This breakthrough underscores the importance of investing in basic science research, for it is through such fundamental investigations that we gain a deeper understanding of the biological processes underlying disease. This knowledge, in turn, forms the foundation for developing new diagnostic tools, therapeutic interventions, and preventive strategies. The discovery of anti-nephrin autoantibodies is not an endpoint, but rather a stepping stone on the path to conquering kidney diseases. The discovery of anti-nephrin autoantibodies represents a significant leap forward in the fight against kidney diseases. But our work is far from over. This breakthrough must serve as a call to action, urging us to intensify our efforts in kidney disease research, raise awareness about these often silent conditions, and advocate for policies that support kidney health. We must continue to invest in research to deepen our understanding of the mechanisms underlying kidney diseases, develop even more sensitive and specific biomarkers, and explore novel therapeutic targets. Raising public awareness about kidney diseases is crucial. By educating the public about the risk factors, symptoms, and importance of early detection, we can empower individuals to take charge of their kidney health and seek timely medical attention when needed. Let us seize the momentum generated by the discovery of anti-nephrin autoantibodies and work together to create a future where kidney diseases are no longer a silent epidemic, but rather a manageable condition that does not define a person's life.